Great. Okay, good morning and welcome everyone. This is the Health Coverage Insurance and Financial Services Committee. And we have a number of work sessions this morning. For everyone's convenience, I'm gonna let folks know what the schedule looks like this morning. I am going to start with the EMS discussion, which I think is 1885. And then we will, did I say that wrong? It's not 1885. It is
1858.
1858. See, I have a little dyslexia this morning. I apologize. And I was doing it off the top of my head. LD numbers should really be words or something. We just call it the EMS bill, and then I'd be able to find it. So we will start there, and then we will pick up the two mandate bills and potentially have a lunch break before we pick up the fertility bill, so that we have a little bit more time, as we did run out of time in our caucus this morning as we were talking about that. So that's the outline for how we will proceed today. And of course, we'll start with committee introductions, and everybody's jumping around the screen right now, but let's start with Representative Quinn.
Hello, my name is Tracy Quint. I represent House District 144, which is 17 towns in Aroostook and Penobscot counties, including the town of Selden.
Representative Arford.
Thank you, Madam Chair, and good morning, everyone. I am Representative Poppy Arford, and I represent District 49, the western part of Brunswick.
Representative Matheson.
Good morning, everybody. My name is Christy Matheson. I represent District 1, Kittery.
Representative Connor.
Thank you, Madam Chair. Good morning, everyone. My name is John Connor, and I represent part of Lewiston.
Representative Evans.
Thank you, Madam Chair. My name is Representative Richard Evans. I represent House District 120, including the towns of Atkinson, Brownville, Dover, Foxcroft, Medford, Milo, Orneville Township, and Lakeview. Thank you.
Representative Blyer.
Thank you, Madam Chair. Good morning, everybody. My name is Mark Blyer. I represent District 22, which is Leamington and part of Buxton, Standish, and Limerick.
Representative Brooks.
Good morning. My name is Heidi Brooks. I represent House District 61, which is part of Lewiston.
Representative Melrano.
Good morning. I'm Gina Melrano. I represent House District 62, which is part of Auburn.
Representative Morris.
Good morning. I'm Representative Joshua Morris. I represent House District 75, which is Turner, Leeds, and Livermore.
Senator Stewart.
Morning, folks. I'm Trey Stewart, State Senator in District 2, which includes 51 communities in Aroostook and Penobscot counties, and I reside in Presque Isle.
Senator Brenner.
Thank you. Good morning, everyone. My name is Stacey Brenner. I represent Senate District 30, which includes all of Gorham, most of Scarborough, and part of Buxton.
Representative Tepler.
Good morning. I'm Representative Denise Tepler. I represent House District number 54, which is all of the town of Topsom. And my husband just spent 2 days in Senator Stewart's district, where fortunately civil courts have begun to hear cases again.
Excellent. I am Senator Heather Sanborn, and I represent half of Portland and half of Westbrook in Senate District 28. We are assisted today, as always, by Colleen McCarthy-Reed and by Edna Cayford. We will open a work session on an LD that has a lot of 8s and 5s in it. And I am going to start by, I think, asking Colleen to bring us up to speed procedurally on where we've gotten to since we last talked about this bill, because we did table the work session to allow for some more conversation. So Colleen, can you give us kind of an update of where we are?
Sure. So LD 1858, you had a previous work session and had some discussion with a number of interested parties during the work session, and ultimately tabled the bill and asked the interested parties who testified and provided input at the hearing and at the work session to meet as a stakeholder group to see if they could reach some consensus on some of the areas and issues that were raised during the discussion. So it's my understanding that that group of interested parties has met twice now and has developed a proposal for the committee's consideration. I don't know if you'd like me to share that proposal, if you'd like to hear from some of those interested parties directly who are in the attendee space. Mr. Hurley, on behalf of the EMS board, was sort of the one who sort of facilitated the meetings, but Mr. Dingman and Dr. Busco, I know, are participated and are here, and there may be others as well, as I see the sponsor of the bill is also in the attendee space. And while I don't think Senator Farron was able to participate in all of the meetings, he has been involved in the discussions of the proposed proposal for the committee.
Thanks. Perfect. I was just going to ask for co-host privileges so that I was able to manage the meeting, and then someone magically gave them to me at just that moment, but I was going to ask for them. So perfect. So I think it probably makes sense, Colleen, to have you screen share the amendment that I understand has been proposed, although I have some concerns about it. So so why don't we have you share that with the committee on the screen, because I don't believe that it's been circulated and it's not really in, amendment form.
No, it has not been circulated, and it hasn't been, I haven't cleaned it up, if you will, and put it in proper amendment form, but I do have the amendment that Mr. Hurley shared on behalf of the stakeholder group, as I mentioned, that has been meeting. So the proposal is to replace the bill with a resolve that would have two sections. The first section would seek to direct some further work by the Board of Licensure in Medicine and the Board of Osteopathic Licensure to consult with the Board of Emergency Medical Services and think more about the issue of delegated authority for people who have an EMS license, and establish parameters for those activities when EMS licensed personnel are performing under delegated authority, not performing under their license, and not, these parameters would not be developed for when EMS personnel are functioning within an existing pilot project. And we talked the last work session about the pilot project that has been approved to move forward in the Jackman area. So it would lay out that the board would discuss developing guidance and parameters around the relationship between the physician and the delegated person, including any contractual relationships, the clinical settings, the education requirements, training requirements, the scope of supervision, and the extent of supervision, whether it's indirect or direct. That the boards would seek input from stakeholders and then report back to the legislature in January. And then they discussed giving the legislative committee authority to submit legislation if necessary in response to any recommendations that are made. And then the second piece of the proposal would put into unallocated statute, unallocated language of statute, a statement that emergency medical services personnel are authorized to provide the services that have been approved by the EMS board for the pilot project. So it would essentially codify the activities that have been approved as part of the pilot. And so that's the proposal as I understand it. I'm happy to, I'll stop sharing. I'm happy to answer any questions that I can, but I was not able to attend the last meeting of the stakeholders because our committee hearings went long on Tuesday. So I wasn't part of sort of the follow-up discussion about why they're putting this proposal forward. So you want to probably hear directly from the members of that stakeholder group.
Okay. And I don't see Mr. Smith in our attendee space, but I did want to let the committee know that Mr. Smith raised some strong concerns, I guess I would call it, with this approach. Mr. Smith is the executive director of the Board of Licensure in Medicine, and had some strong concerns about the first part of the resolve, I think, and whether it was workable.
Yes,
So
and I did also hear just before you started that from the Board of Osteopathic Licensure, and they just emailed to say that they concurred with, the email that Mr. Smith sent on behalf of the Board of Licensure in Medicine in terms of their available resources to sort of actively or proactively supervise delegated authority.
yeah. Okay, so I think at this point, in the interest of fairness, it makes sense to bring in the folks who were participating in the development of that proposed amendment, which I know includes Mr. Hurley. I think it includes Mr. Bradshaw, Mr. Busco, Dr. Busco. And so I'll just start bringing folks in, and then if I didn't bring you in and you want to be brought in, let me know. I will bring, oh yes, Charlie Dingman in as well. And I'm going to bring in the sponsor of the bill as a courtesy as well. I think I did that right. Okay. Good morning, gentlemen. Thanks for joining our work session. I think it makes sense to start with Mr. Hurley. Mr. Hurley, can you summarize the discussions that led to the amendment that's been proposed?
Yeah, absolutely. Thank you so much for having us today. So there were 18 people on the conversation that we convened twice in the interim since our last conversation with this committee, including members from the PCHC, as well as the Maine Ambulance Association, myself, Northern Light Healthcare, and some other interested parties. In our conversation, we were trying to better understand the need for the bill as far as what did it change today. And the bill, whether you pass the original language or not, like the original language that was written into the bill was not required to conduct the Jackman project. It was not required for people to work in urgent cares, in nursing homes. They could work in those settings as a medical assistant. The problem that was raised was, where is the line between what they can and can't do? Because for nurses, you can't delegate above a nurse's scope. But for paramedics, there isn't any language about that. And that is part of the reason why we went down this rabbit hole of, we really need the Board of Licensure in Medicine and the Board of Licensure in the Board of Osteopathic Licensure to really opine on what those relationships are, and to say, can you delegate beyond someone's scope and training? And because this is really their licensees delegating, it's not the Maine EMS board. And so that's why we invited the boards to the last meeting. They were unable to attend. They did send their concerns, as was forwarded to the committee, or at least to you, Senator Sanborn, that, delegation is defined by usual and customary, I believe is the language they used. But we needed a little bit more definition there, because particularly in Jackman, paramedics are doing things that paramedics are not traditionally trained to do, like doing suturing and doing other things that are outside the traditional scope of practice. Maine EMS, particularly for that project, has put in a framework to make sure that that can be done safely. But as was iterated by the Board of Licensure in Medicine, they have no capacity or bandwidth to ensure that framework is put in place before it happens. whereas the Board of EMS, we are a little bit more proactive on the side of regulatory enforcement. So it's really just trying to define the lanes and to make sure that we're not stepping on anyone's toes. And so that's really what we want to do here, is to bring everyone to the table, help define the lanes before we start putting things into law that may have unintended consequences. Because I think at the end of the meeting recently, we all were kind of thinking, if we pass the bill as currently written, there's going to be a lot of untoward consequences that we don't quite see yet. And so we felt that it was prudent for us to kind of better understand what's going on. And section 2 is really just to make sure and to provide, to be candid, cover for PCHC and the Jackman Project so that they know that the program, as long as it remains approved by the Board of EMS under our existing statute that allows for pilot programs, that it can continue to function in that capacity. And so that's how we got to this point. And I would welcome any other members of the group to add any additional details, but that's kind of a high level summary of how we got from point A to point B.
Okay, at this time, I'm gonna invite the other folks who have joined us, who were part of that group, to add anything or clarify anything that Mr. Hurley might have said. I saw a hand go up. Dr. Buska, go ahead.
Yeah, I think what became the core question was how preemptive are the delegated authority statutes. The delegated authority statutes as written don't require a delegee to be an employee. They don't set limits. The Board of Licensures, the two boards essentially give that authority of limit setting to the physician licensees and say your responsibility is that they're properly trained. And so I think the question becomes one of, I don't think anybody's asking the Board of Licensures in medicine or osteopathic licensure to write up a set of, well, these are the outer boundaries of what can be delegated. I think the question that needed to be clarified was in their interpretation, can anyone else step between that relationship between the physician delegating and the delegee? And if so, under what circumstances do they think that another entity like the main EMS board stepping in would be appropriate? And I think if that answer were clear from the boards, then whether or not there's a need for clarification in this statute would become much clearer. Because if the boards say we interpret this as being an absolute relationship and we don't require employment, then it truly falls on the physician delegating their authority to make sure the person's properly trained and properly supervised and doing only things that are appropriate. Whereas if they say, no, just like for nurses, there's a carve out, we think that if someone happens to hold an EMS license, there should be a carve out as well that limits them to whatever that is, whatever their license scope would be, then that's also provides a lot of clarity. But it comes down to in some ways, the simple question of right now, as a physician, I can hire someone off the street, train them how to do a urinalysis and to flush somebody's ear, and that falls well within my scope. I could go to and if I hired them and they had an EMS license, and so far Director Hurley's been clear, main EMS doesn't want to come after that person if I have a direct employment relationship with them, but there's nothing in the delegation statute that requires me to have that employment. So the question is, if I go to an ambulance service and say, I'd like to contract to have some of your EMTs come and work, can I delegate to them the same things that I would if I either directly employed them or if they didn't hold an EMS license? And I think that clarity will make the rest of the discussion and need for any statutory changes much clearer.
Okay, that's helpful. As I read it, that's not what section 1 of this resolve does. So that's my concern. that what you just described is completely different from how I read section 1 of the resolve. So that's my concern. So laying that out there, let me invite Mr. Dingman or Mr. Bradshaw to weigh in if they're interested in adding anything else.
If I may, thank you for the opportunity. As may have become clear already, the concern that PCHC has here is fairly narrowly confined to protecting what has already been approved and is going forward. And the concern that we had is that if and to the extent we start talking about sort of reformulating or redefining the roles of the various licensing boards, we want to be sure that what has already been approved and is going forward is not affected by that for so long as it is an approved pilot project by the main EMS board. So that's what we're trying to accomplish in section 2. And we respect and appreciate the larger conversation that's going on about other ways to deploy EMS personnel. And we think it's a worthwhile effort, but we do not have a strong position on exactly what form section 1 should take.
Okay, thank you. Mr. Bradshaw, do you want to add anything?
Thank you, Senator Sanborn. I really don't have much to add. Not an attorney. I'm one of those people that we're on the other side of this. So I think the way it has been described to you by Director Hurley and Dr. Busco nicely captures our concerns. It'd be very helpful to hear from you and other attorneys on legal changes that need to be made to get us there. Thank you.
Okay. All right. Are there questions from other members of the committee? Obviously, I've monopolized the discussion a little bit to date, so let me widen the scope here and invite other members of the committee to ask clarifying questions, either of Colleen or of other folks who have joined us from the stakeholders group. All right, I don't see any hands go up, so I'm just going to keep driving the ship, friends. And please feel free to put your electronic hands up when needed. As I think I'm asked questions during the last work session, I'm trying to parse out the role, the section 1 of this proposed resolve would appear to me to make it such that if you held an EMS license, but were not performing under that license and not functioning within an existing pilot project, so like pull away everything related to the Jackman project, pull away anyone who is functioning as an under their EMS license. And then it appears to ask the Board of Medicine to impose stricter parameters on those individuals than they would on an individual who did not hold an EMS license and in fact held no license whatsoever. And the board, I think, rightly is pushing back a bit on that implication in the section 1 of the resolve. So I'm a little bit confused by that implication. Perhaps I'm misunderstanding the draft, Mr. Hurley. So that's the part that bothers me. I don't like the idea that if I had an EMS license, I could actually do less or somehow get in more trouble than if Mr. Busco hired me for his private practice off the street and trained me to do a urinalysis as he just described. Can you speak to that, Mr. Hurley?
I think what we were going after here is that they're not working on 911 response. So they're not doing a traditional 911 response. And so that's really the niche we were trying to capture. We weren't trying to venture into I work as a paramedic somewhere else, or I work as a medical assistant somewhere else. And just because I have a paramedic card in my wallet magically makes me applicable to other statutes. That's not necessarily the lane we were trying to get in. What we were trying to get in is this gray region where they're working they're working in a clinic or they're working somewhere in a paramedic role some of the time, and they're working part of the time as a medical assistant. Where is that line? And that was what we were going after. Because when you hire a nurse to work as a nurse. If you hired a nurse to work as a medical assistant, then they could delegate whatever they wanted to. But when you hire a nurse, they work as a nurse, and there are carve-outs for what a nurse can do when they're working as a nurse, or what can be delegated to a nurse when they're working as a nurse. So I think that's the kind of lane we were trying to get this into, and maybe we probably could have worded that a little bit better of, if they're hired as a paramedic and they're functioning as a paramedic role, where is their lane? Where is the lane here? That's, outside of 911 operations, because 911 operations falls clearly in our shop.
So let me see if I can outline this in another way, because I do think that there is some lack of clarity in the 2019 statute that's on the books. And I think that it has a negative implication that should be cleaned up. And so I do think that there's potentially both a statutory cleanup and some unallocated language that needs to go forward. So let me see if I can try and clear and ask you this question, Mr. Hurley. It strikes me that if the contract that Dr. Busco is referencing is with an entity separate from a regulated EMS agency, that doesn't worry you, or that cleaning that up to make it clear that you could hire a medical assistant who also happened to have an EMS card in his wallet, as you just described, does not run afoul or should not run afoul of our statutory language. And I think right now it does. If you hire them through a medical staffing agency, for example, and don't have a direct employment relationship with the individual, to me, that looks like a gray area in the current statute, but it's not one that worries you all that much. The one that worries you is if they're clocked in to their role with the Portland's, MedQ service or Portland EMS service. And part of the time they're responding to 911 calls. And on that same shift, sometimes they're also acting as a medical assistant for someone in a hospital or in a long-term care facility. Have I correctly set out the two different possibilities?
Yes, ma'am. That's what concerns us, because we currently already allow for people to work in urgent cares, people to work for, like Dr. Busco doing urinalysis. That already is allowed for and is currently general practice. I work in an urgent care myself. So that's not barred. Although the language in the statute says employed by a hospital, Maine EMS does not venture into that realm of whether it's a hospital, an urgent care, or some other realm. We view those as medical assistants, but they're employed by that agency, and it's irrelevant whether or not they have a card in their wallet that says paramedic or EMT.
Okay.
Or you're trying to get that niche where they're doing both at the same time.
Yep. I think I understand the confusion and the issues, and I think there's maybe three different scenarios that are at play, and the language is all crossing over. Mr. Hurley, would you agree that even though the EMS board doesn't take any action, it's not strictly in accord with what the statute says that was passed back in 2019 to allow for you to work at that urgent care facility, for example?
So based on my understanding of the statute, isn't permissive, or it doesn't bar people from doing so. All the statute does is it bars the board from taking any acts, from saying anything about it. But the board has taken the stance that currently taken the stance that we aren't going to speak to that. So it doesn't, you wouldn't need to change the statute to allow for it to happen. Though if you change the statute, all you would do is bar the board from taking, you would reduce the board's regulatory authority. That's all you would do by changing the statute, because the way the statute's written is it says the board can't do anything in these areas. And the board has already taken the stance that we're not going to do anything in these areas. So you would just be taking regulatory authority away that we're not using. But, you know, that's a choice that you would make.
Okay. Mr. Dingman, I saw your hand go up, but then it went down. Would you like to say something?
I would just add that, you know, I do think it's a peculiar provision that we're looking at, because all it does say is that certain things are sort of in a safe harbor, and the safe harbor is too narrow as it currently stands. But it does, so as my colleagues worked on the Jackman project, for example, we looked at that language and said, well, that doesn't actually prohibit what we're trying to design. It simply doesn't give us comfort about what we're trying to design. So in that sense, I think in our view, there's no great urgency about clarify. It's desirable to clarify it, but there's no great urgency because it doesn't actually actively prohibit what it omits.
Understood. Okay. Mr. Hurley?
And to just add one thing is our idea was that once we had this clarification from the Board of Licensure, Medicine, and Osteopathic Licensure, we could then go back and potentially provide further clarification, just so we didn't start changing things because we were worried about it, because it doesn't prohibit anything.
Okay. All right. I appreciate this conversation. I still don't see any other hands up from my committee. Representative Arford, go ahead.
Yeah, I'm just gonna, it seems like there's a couple of documents. Colleen showed us one on the screen, and then maybe some other emails that have gone around. And it's hard for me to follow the conversation without having those at my disposal, so I can refer to them as we speak. Is it possible for us to all have access to the same documents right now?
Yes, Colleen.
It would be very helpful for me.
Yeah, and to be clear, I'm not going to go to a vote on this because there's no text that's been circulated more broadly, and the time frame just didn't allow it with us in session yesterday. I wasn't able to look at this until last night. And I have some real concerns with section 1 of the resolve. So I don't intend to call a vote today. So all of that material is going to be, able to be continued to be developed, and we'll have some text in front of us. So if that's helpful, Representative Arford, but I do understand it's a bit awkward. And I really wanted the stakeholders to be able to, that had done the work, to be able to kind of try and explain what had happened. And then I'm going to wrap this up actually pretty quickly here, I think, unless there are others who want to jump in. Representative Evans, go ahead.
Thank you, Madam Chair. I just have one question. Mr. Hurley, is your intent going forward to lay out a roadmap for the Board of Licensure and medicine as to what after you've decided what you're going to do as for a scope? Are you planning on presenting this? Because I'm not clear on that.
I'm a little confused as to the question. Our intention is to bring the medical boards to the table to have a conversation of where the lanes are. And then from that conversation, go forward with moving forward from that conversation, because it may be that the Board of Licensure in Medicine says, okay, we're going to do a carve out just like we do for nurses that say they can only perform the scope as to nurses. So that would go back to the Board of EMS, where we would have to develop an expanded scope like that includes urinalysis, because we're not doing urinalysis on an ambulance. So we would have to expand our scope within EMS. So it's going to be a back and forth. It's really just figuring out where those lanes are. So that way we can clearly define if something goes wrong, or where does the regulated person fall to? Does it fall to over to BOLM, or does it come to EMS? And that's what we're really trying to find out. But it's going to have to be collaborative work between all of the boards and main EMS and stakeholder input.
Okay, thank you. That answers my question.
And again, Mr. Hurley, I think you mean in the context of when someone is operating sort of in that logged in as a paramedic,
In the gray realm.
single job, single employer kind of situation where they're so maybe future pilot projects or future collaborative relationships between agencies is more of the context that we're trying to sort out. Okay, I think this is really, really helpful. It's been helpful to me to understand the different issues at play here. What I'm going to suggest, because I don't think that section 1 of the proposal that went around actually gets at what we just discussed, or at least not in a very direct way that I think would be helpful to the Board of Medicine, because I think they read it as I did to be much broader than what Mr. Hurley is actually seeking clarification around. And I do think that the statute from 2019 could potentially use some tweaking. So I'm going to propose that that we work toward another draft that actually gets circulated prior to our next work session, but that potentially makes a statutory change and then has 2 sections of unallocated language. And one would be so that the statutory change would make clear that all healthcare facilities can access folks as medical assistants, and the sort of when they're working in that direct role as employed by either a staffing agency or in a medical setting. Just because you have an EMS card in your pocket doesn't make you disqualified from having delegated authority. And I think that needs to be a statutory change, because I appreciate that the board isn't taking those actions today, but I think that they could, and there's not a safe harbor for that type of second job moonlighting kind of role. And I have a concern about that. So there's that statutory change. And then I think there's 2 unallocated languages. One is to protect the pilot project and just have a very clear safe harbor around the pilot projects. And I think we all agree on that. And then the third piece is that sort of what would future relationships that are gray directly between EMS agencies staffing out their people during, the course of their paramedic duties to work in different medical settings. What would that look like? And that needs to be a collaborative discussion, as you just described. So those are the 3 pieces that I have in mind. And I think Colleen and Mr. Hurley and others on the screen and I could work on that language over the next week or so. So I'm going to lay that out as our path forward, and welcome feedback from either the stakeholders on the screen or the committee with regard to that plan. Please raise your hand if you wanted to weigh in on that. All right, I don't see anyone weighing in on it. So you have either put everyone to sleep or I'm not sure. Representative Tepler, go ahead.
Is this a good time to suggest a tabling motion for the bill till our next work session?
I'm seeing nods of assent from other members of the committee. So go ahead, Representative Tepler.
Thank you. I move that we table LD 1858 and we'll resume a work session at a later date. Do we have a date?
No,
okay.
But that's okay. So we have a tabling motion on the table. Is there a second? Representative Connor has seconded. I anticipate it will be unanimous, so we'll use our physical hands function in the window. Representative Evans, are you raising your hands? Okay, great. So the bill has been tabled, and we will come back with some additional language. Thank you, Senator Farron, for joining us, and the other folks who are working on this language. Thank you as well, and I look forward to continuing the conversation. All right, so we're going to move folks back out of the panel here. Just bear with me a moment while we clean up our Zoom.
Senator?
Yes, ma'am. Representative Tepler, go ahead.
Yes, thank you. Can we take up 665 before 1539 so I can notify the sponsor of 1539
Yeah,
when we'll be taking up her bill?
it's my intention to take up 1539 after lunch.
Okay, good to know.
So that we could finish up our caucus discussion on 1539. So I think next we will take up, I'm not sure who's at the lake there. I think next we will, okay. We will take up 665. And Colleen, can you recite the title of the bill? I'm forgetting the exact title of the bill, and let us know where we were when we tabled it last.
Sure. LD 665 is an act to promote better dental care for cancer survivors. This was the bill that we discussed last time. The Bureau of Insurance did a mandate review study on it, and you discussed it at your last work session. And we're kind of honing in on thinking about what language you might be interested in moving forward. And there were two options for language for the committee to think about. One version was broader, as laid out in the mandate review by the Bureau of Insurance. And I'm happy to pull the language up for you, but essentially it would clarify the statute and require that carriers offering health plans in the state would be required to provide coverage for medically necessary dental procedures for enrollees diagnosed with cancer. And they would be required to provide coverage for dental procedures medically necessary to reduce the risk of infection or to eliminate infection or to treat tooth loss or decay in an enrollee prior to beginning cancer treatment, including chemotherapy, biotherapy, or radiation therapy treatment, and any fluoride treatment that might be required. The coverage must be provided for dental procedures that are medically necessary to reduce the risk of infection or to eliminate infection or treat tooth loss or decay that would be the direct or indirect result of those cancer treatments. And the coverage would be required to for any lab services associated with those medically necessary procedures. There would be language that you talked about last time that would also state that carriers would not be required to provide coverage for routine preventive dental care or cleaning as part of this legislation, but it would be focused on those medically necessary procedures. So I think that's where you left off last time. If you did move this forward, you also talked about an application date and what the application date would be. I think generally you've looked at an application date for the upcoming plan year, which would be plans issued on or after January 1 of 2023. So I think that's where you left off. And I'm happy to sort of pull up that language or go back to any of the information included in the mandate report that the Bureau provided.
So committee, in the interest of kind of moving things forward, I think option one, which was the broader language as I understand it, makes a lot of sense. So I'm inclined to make a motion to just have that on the table, that we adopt option one with an effective date of January 1st, 2023. And then that we also include a statement, as we did with the other two mandates of legislative intent, that it's not an expansion, or I forget the language that we used, but basically saying this is medically necessary in order for cancer treatment to go forward. So it should be properly considered a clarification of the required, the EHB, whichever, whatever, yes. I can't think what EHB stands for right now, but the required health benefits.
Essential health benefits.
Essential, thank you. That was the word I couldn't think of. Gosh.
Yeah.
Okay. The essential health benefits paragraph that we had described in the other two mandates. So that's sort of the parameters of what I'm thinking. Is there committee input on that before we kind of turn that in, or does someone else want to turn that into a motion? Representative Morris.
Thank you, Madam Chair. No, I'll certainly second. I think our discussion in caucus was that this is a necessary for preserving a person's health. So I think it's a good use of mandated benefits. So I'm certainly willing to second that motion. If you were making it as a motion, or if you need me to make it as a motion, whichever way you needed.
Okay. Great, thank you, Representative Morris. So we'll consider my description a motion and a second from Representative Morris. Is there further discussion from the committee with regard to this issue? I don't, oh, Representative Brooks, I see a physical hand. Go ahead.
So I would just reiterate, I'm really grateful that the motion presents a step in the correct direction in my mind. And I think it's important for all of us to keep in mind how much our mouth does for us every day with chewing, smiling, everything. It's just so essential to our person. And it's how painful it is if there could be a problem there, and how deleterious it can be to one's health. So I think with cancer care, I really thank the sponsor and proponents for bringing it to our attention, because the more we learn about dental care in our whole body and our well-being, I don't know that there's any more critical, timely legislation that if we don't do something emergently, it will really be cause a lot more pain and suffering. So I'm hopeful that we're taking a step in the right direction. You know, of course, I would push a little further, but I'm happy that there is a statement from the committee or the motion to take a step in the correct direction in my mind.
Thanks, Representative Brooks. All right, not seeing any other hands raised. It looks like the committee is ready for the question. I think we have a clerk available. Yep, there's Edna. Great. So go ahead and call the roll.
Thank you. Senator Sanborn.
Yes.
Senator Sanborn, yes. Senator Brenner.
Yes.
Senator Brenner, yes. Senator Stewart.
Yes.
Senator Stewart, yes. Representative Tepler.
Yes.
Representative Tepler, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Bleier.
Yes.
Representative Bleier, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Evans.
Yes.
Representative Evans, yes. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Malorano.
Yes.
Representative Malorano, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Quinn.
Yes.
Representative Quinn, yes. 13 members of the committee having voted in the affirmative, 0 in the negative.
Thank you very much, Ms. Capert. All right, so having concluded those two bills, although we've only been on screen for an hour, I know a number of us have been working diligently on legislative matters since early this morning. So I am going to suggest that we break for lunch, give us a chance to finish up our internal discussions and also have some lunch. And so I'm going to suggest that we come back at 1 o'clock. It's just noon now, so we'll come back at 1, and then we just have the one bill 15 39. Is that the right LT number? Okay. We just have that one bill that will pick up at 1 p.m. So thanks everybody. Enjoy your lunch, and just a reminder to turn off your camera.
It's not my exact.
Lauren, I have to go. I have to go back to my meeting. I'll call.
Representative Arford, please mute yourself. Thank you. Okay, looks like people have stopped joining, so we will reconvene, and we've got a quorum. So we will open a work session on LD 1539, and I will turn to Colleen and ask her to remind us where we left off.
Sure. So LD 1539 is an act to provide access to fertility care, like LD 6665 that you talked about earlier. You had a previous work session on these bills that proposed mandated health benefits under the main insurance code and tabled LD 1539. I think for a couple of reasons. One, to give you a chance to review the mandate report more in depth that the Bureau of Insurance provided, which you discussed at the last work session. I also was able to provide some additional follow-up information, sort of giving you a chart outline of other state laws and some additional information that I was able to pull together about cost analyses that have been done in other states, and some issue briefs about sort of costs of infertility treatments in general. So I was able to share that additional information with you that was I was able to prepare with help from the research staff here in OPLA, and also with advocates like Fertility Within Reach and Resolve New England. So I want to help thank them for their assistance in helping to pull together some of those materials related to other state laws. So I was able to share that with you. And then I think the second thing that you wanted to hear today is you had some questions about if you made some changes to the bill, particularly in how or whether or not a mandate might be applied in the individual market versus the group market. You had questions about what the impact of a merged market would be on those decisions. And I do believe the Bureau of Insurance is here and can speak to that if you wanted to hear from them. They've had a chance to, I was able to chat with them and give them a heads up. And I think they may be able to share some insight with you about that question. I'm also happy to pull together any of those additional resources and share screens for you. I could also go back to the original bill too, if you wanted to sort of go over what the bill itself would actually, as it's drafted now, and as there was a technical amendment change, clarifying some of the definitional sections from the sponsor, Representative Madigan. I could bring that up for you as well. But I think that's where you are to sort of jump off your discussions today. I know Mr. Yardley is here, and I believe Ms. Hooper is here, and I don't know if both of them are prepared to speak to that issue about the impact of the merged market. I expect maybe you might want to bring both of them over if you get to that question. I know there's other folks here in the attendee list that can speak to some of these issues as well.
Thanks, Colleen. I think the question with regard to the merged market only arises if we were to limit the applicability of the mandate. Isn't that right?
Yes, I think that's right. So the bill as it's proposed to you would apply to both the individual and the group market, but you talked last time about some of the other state laws, particularly New Hampshire, which has moved forward with a mandate on infertility most fairly recently, but they limited it to their group market. And so I think that's really the context. If you were interested in doing some of that, which some other states have chosen to do, the question arises about what impact a merged market might have on that decision, or if any.
Yeah, I wanted to really just take this opportunity to thank Colleen and those who helped her pull together all that additional material. I read it with great interest, and I know that it has been very helpful to other members of the committee as well, and that we reviewed it very carefully. So even if we don't go into an in-depth discussion about it today, I just wanted to say that we appreciated all of the work that went into it. And I think it really helped crystallize my thinking on where I wanted to go today. I'm going to open it up to the committee for either questions, if anyone wants to get further clarification or ask questions of Colleen. All right, not seeing any hands go up. I think at this point, I'm just going to open it up for committee discussion or potentially a motion. You guys are making me do all the work again. Come on, somebody else play. Representative Morris.
Thank you, Madam Chair. I'll play. I think, yeah, our position is we just don't think this is really the right time to be adding this kind of a mandate into the system. The real concerns I have are, one, with the merged market going on, everything that was done on that. I mean, I know we've had many discussions about that, but obviously the idea of it is to hopefully bring about some savings, at least to the group plans. And I think this would certainly have an impact on that. I'm not sure that the current, even with the current mandate study, it probably did not take into effect, because I don't think anybody could have foreseen coming the rise in inflation. So that's going to also add costs onto it. There's also the concern that within the business community, that, as you know, when you add a mandate, the cost gets shifted onto the ratepayers. And oftentimes businesses, when they're put in that position, they have difficult decisions to make in terms of whether or not they're going to cover additional, how to pay for that additional cost to their benefit structure, whether it be making the employees pay a higher percentage in the premiums, shifting cost shares. In any event, it does end up, or having to reduce hope for wage raises. And so I think for this type of benefit, given how much it will cost, not to mention the potential fiscal note, I just don't, I certainly could not support this at this time. And it's just a very difficult environment, I think, to support a new mandate like this. So that is why I can't vote to support this today.
Thanks, Representative Morris. Additional comments from the committee? Representative Tepler.
Thank you, Madam Chair. I'm sorry I hopped on a minute late. I did wonder if we could ask Ms. Kate Weldon LeBlanc to come in and comment on the costs associated with this potential mandate.
Okay. Let me find her. Let me make sure I'm a co-host, which I'm not. So Colleen, would you mind moving Ms. Weldon LeBlanc in for us?
You should be on our way.
Thank you. Good afternoon, Ms. Weldon LeBlanc. Representative Tepler, do you have a specific question from Ms. LeBlanc? Can you ask her a specific question?
Yes, I'm just wondering if she has any thoughts or comments as a person who specializes in analyzing the costs associated with this in regards to some of the conclusions that Representative Morris has presented us with.
Okay.
Sure. Thank you, Chair Tepler. And thank you all for your thoughtful consideration of this bill today and in all the other previous sessions. We do consider the cost analysis that was released as, it seems to us, very inflated cost estimates. We don't deny that a new mandate like this is going to increase costs in some way. And it's difficult to know exactly what the methodology was behind some of the insurers' estimates of what they think the increase in cost is likely to be. But what we look to is partly to other states that have had laws like this for a long time and what their costs show. And nothing in the range of what we saw in this cost analysis is true in those other states, particularly as it relates specifically. We know your concern has many layers, but one of them is the direct impact to the state. And as it relates to state employee coverage, in the cost analysis, Anthem estimated that the increase for state employees only was going to be over $8 per member per month, but with no explanation of how they came to this estimate. And that particular figure was concerning to us because actually your main state employees already have some fertility coverage today. Unfortunately, it's only a $10,000 lifetime benefit. And as you heard in the testimony, and as you may know from your own family and friends, $10,000 doesn't go very far with fertility treatment, but there is already an existing benefit. And I'm not sure that was factored in, nor were the current cost, real cost information used in the projection of what they think it might cost. It was certainly our intention that this bill would not be a cost burden to the state, a significant cost burden to the state. That's why the Medicaid program is not included in this legislation. We did not think the impact to state employees was going to be too significant because there is a benefit already in place. And we don't expect that the federal government is going to ask Maine to defray the cost of the new benefit. So for all those reasons, we did not see a direct cost impact to the state that was going to be too significant.
Are there additional questions for Ms. LeBlanc? And I think, oh, I'm sorry, I didn't see the hands. Representative Morris, go ahead.
Yes, thank you, Madam Chair. I appreciate Ms. LeBlanc, your passion on this, and we understand why this is important to many people. But obviously, the concern, my concern is the cost. You stated you thought that the cost might be inflated on the on what they're projecting it would be to the business community. I just want clarification if that's what your thought process was.
Well, I think the estimate related to the state employees seemed extremely large. We've never seen an $8 per member per month estimate anywhere in the country, including much bigger states with huge urban centers. So again, we just don't know where that number even came from. But even the overall summary kind of summary estimates seemed really high when they were in the $4 or $5 per member per month range. Many states that have infertility laws have never approached those amounts. And I do want to just share with you that as Colleen mentioned, New Hampshire is the most recent mandate that's been passed, obviously your neighboring state. And it actually, of course, we had this cost discussion, of course, but that bill actually had bipartisan support because of the economic benefits that bills like this can bring to businesses. It was signed by Governor Sununu because he was hearing from employers that said it's difficult for us to keep and retain young employees. If they have fertility concerns, we're losing them to Massachusetts and Rhode Island and New York. So I really, truly appreciate your perspective on costs, but it is a two-way street. And like I said, I want to assure you, we really, truly feel those estimates. I think they were thoughtfully created. I'm not criticizing the creators of the analysis, but I think because it seems to rely so much on the insurer's own estimates without an explanation of how they got there. I really don't think Maine will ever get to a $4 per member per month increase. That kind of increase has only been seen in Massachusetts, and Massachusetts has had a law for 30 years. That took us a long time to get to $4. We're a larger state than Maine. We're a more populous state than Maine. And we have the highest rate of ART births in the nation. So it would take, I don't think Maine will ever get there, honestly, and it might be 30 years from now.
Right. But, and again, I would just, Massachusetts is also a more affluent state than Maine too.
Well, perhaps, I don't know that information myself, but I will say again that there's been an economic benefit because the fertility clinics have grown because there's insurance here. And we would expect the same thing in Maine, that it would be actually an economic development thing. After the New Hampshire bill passed, a full-scale fertility clinic was built in Bedford, New Hampshire, particularly because the mandate passed. So.
Representative Bleier.
Yeah, okay. Thank you, Madam Chair. Thank you, Ms. LeBlanc, for being here. So multiple questions, I guess. So it's kind of, we passed the mandate, then they'll build the facilities like you said, but it's kind of like, it's a tax write-off. But you still have to pay for it, right? So I'm a little confused on that particular comment, but my true question is that you said that 10,000, you said state employees, they figured it about $8 per member per month. And you said that that's pretty high because they already receive benefits up to about $10,000 a lifetime. But then the second comment you made was, but $10,000 doesn't give you very much. So if the $8 is an inaccurate amount, what do you believe would be an accurate amount?
Well, I personally don't feel like I'm qualified to say that, but what I will share is just, to me, it would make sense for a projection to look at what the utilization is of that $10,000 benefit that already exists, and then use that to project. You're right. Some employees are going to hit that cap without very much treatment at all, but other people are successful before hitting that cap. Sometimes it's just a minor thing that people need to solve their infertility challenges. So I think, to me, seeing what the actual utilization is, and then maybe projecting from there what more is needed for people that have maxed out that cap would be a better way of estimating. And again, it's not clear how they got to that $8 amount, but all I can tell you is that is twice as much as what the entire cost of the mandate in Massachusetts is. And that's not a projection, that's actual costs. So how the state employees only would be twice as much when they already have a benefit just doesn't seem, again, this isn't my area of expertise. I'm an advocate and an IVF mom myself, but just my common sense approach is just that it doesn't seem like that could be the case. But I totally hear you. And my comment about potentially the fertility treatment practices growing and expanding in Maine was just to say that would potentially be new jobs and new and access to care. Right now, the only full service IVF clinic in your entire beautiful state is in Portland. So as you well know, that leaves a lot of Maine traveling major distances if they can even afford to try fertility treatment.
May I follow up, Madam Chair?
Yes.
So just out of, as a legislator sitting here listening to information, when you say to me that this is not your wheelhouse of expertise, it just seems odd that the $8 per member per month is high. When we're listening to information, then, the insurance company is saying that this is what would cost the people of Maine. Because this is not your wheelhouse to say it's not accurate, then for us to say then we're going to take their analysis as true figures would be how we would move forward on this bill, because they've done the research and this is not your wheelhouse. Would you say that's a fair statement?
Well, what I meant, I hear you again, respectfully, but what I meant is I'm not a cost actuary as my job, but what we do have at our disposal are the cost analyses done in other states that have had these laws for a long time. And the majority of those are in the $1 to $2 range per member per month for their entire plans, including much larger states or much more populous states. So that's where it seems strange to me. And so, no, I'm not just using my opinion or my feeling. I'm looking at those actual studies that we have from other states and trying to correlate that way.
Representative Brooks, do you have a question for Ms. Weldon LeBlanc? Go ahead.
Well, the question, and again, maybe it's more of a further discussion issue, Ms. LeBlanc, Kate Weldon LeBlanc, thank you for your participation. A question I have to you is, how long has it taken to get where we are today in Maine, as far as fertility treatment in your historical perspective?
Well, I don't know if this will be what you had in mind, but I think unfortunately, because Maine is now one of only 2 states in New England that does not have fertility coverage, the majority of Mainers do not have access to fertility treatment. They cannot afford to even try. They're emailing me and asking how this bill is doing and when it would take effect, if and when it passes. They're literally waiting. They cannot even try one single cycle in some cases without insurance. Or again, to think about the economic effect more broadly, they are dipping into retirement savings and putting off buying homes and all kinds of things that impact the Maine economy because they can't afford fertility treatment. So I would say Maine, frankly, is behind in terms of being truly accessible in terms of fertility care and family building. And I know you all are very pro-family, and unfortunately, this is an example of Maine being behind the other New England states on this particular issue. I love Maine, but on this, you're behind.
Okay. Are there any additional questions for Ms. Weldon LeBlanc? All right. Thank you for your additional input today. I'm going to move you back into the attendee part of the meeting. Oops, I'm not going to move you back because I'm not a co-host, but Colleen's going to move you back.
I will.
Thank you, Colleen.
Awesome.
Great. Thanks. Senator Brenner.
Thank you, Madam Chair. I would like to sort of frame the discussion further by putting a motion on the table to pass as amended with the technical amendments that the bill sponsor presented that Colleen outlined in the analysis.
Thanks. Colleen, can you just remind us for the point of clarification if the technical amendment included an applicability date?
Yes, the amendment, it has proposes a January 1, 2023 application date for the bill. Really, the only amendment from the original was just making some clarifications to the definitions of a fertility patient, adding that someone qualifies as a patient if they are an individual or a couple who is at increased risk of transmitting a serious inheritable genetic or chromosomal abnormality to a child. And it clarifies the definition of fertility treatment to mean procedures, products, medications, and services intended to achieve pregnancy that results in a live birth with healthy outcomes and is provided in a manner consistent with established medical practice and guidelines that were adopted by the American Society of Reproductive Medicine. So those were really just the two technical changes, and the application date would be 1/1/23.
Thank you. Is there a second for Senator Brenner's motion? Seconded by Representative Matheson. All right, further discussion? Senator Brenner, did you want to follow up?
Sure. I really feel strongly that this coverage is important to offer to our young families in Maine. We want to hold on to people. We don't want to lose people. We've encouraged people to participate in employer-based healthcare systems as one of our models of insurance here in the state of Maine, across the country. And for a lot of people, the act of giving birth is one of the first experiences where they engage with the hospital system. So the experience of infertility for a lot of people is one of their first experiences of engaging with a healthcare system in a really big way. It's important for us to remember these are folks who are still managing loans from college, who are trying to buy homes. I mean, this is a group who's saddled with a great burden financially. And we want to be a state that supports family building, family growth, that encourages our hardworking Mainers to stay in our state. And we, I think, have a responsibility to not only make insurance affordable, but also make insurance a product that makes sense for people. And increasing the capacity for coverage for infertility services is one of those spaces where we have the ability to make change happen. Thank you.
Representative Morris?
Thank you, Madam Chair. I noticed that Chris Ossenfort's in the room. I wonder if she could come in, because had some questions just on how they arrived at the state employee plan estimate. That seemed to be an issue. And then I had a couple other questions as well.
Yep. Again, I still don't have host privileges, so Colleen, I'm going to need you to move Ms. Ossenfort in.
She's coming.
Can someone give me host privileges? I'll streamline things a little bit.
We've been trying, but I think Edna's having some problems. So
Okay.
it's the way it was set up.
I will check and see if I can get that for you.
Yeah.
Okay, thank you.
We've got two hosts, and Edna's not the official host, and that's the problem. So
got it.
I can't do it either. But here's Chris. She's here. She'll be here now.
Perfect. Good afternoon, Ms. Ossenfort.
Good morning. I mean, good afternoon.
I think Representative Morris had a question about how, if you could speak to the issue raised about the $8 per member per month in the state employee plan. You've disappeared on us and gone on mute again.
Yeah, I've turned my video off because it seemed to.
Yep, we're having trouble hearing you. So thank you for turning your video off. And maybe you could start again.
Can you hear me now?
We can.
Representative Morris had some questions about the estimate for the state employee plan.
Yeah, I think we're not catching all of the words, but yes, we had questions about how you arrived at the state employee plan amount.
So it does significantly broaden the coverage under the state employee plan that exists today. And so I think that is the basis for the increase. As was noted, it's subject to a $600 deductible and a $10,000 lifetime limit. This would remove those limits and would also expand what would be covered and how it would be covered. I don't have the analysis in front of me. I can go back to our actuaries to confirm that they did take into account the fact that the plan currently covers it. I believe that they did. And certainly they would have taken utilization and the demographics of the state employee plan into account.
Thanks, Ms. Ossenfort. Representative Morris, go ahead as a follow-up.
Yeah, I just have a a follow-up just on something else that was discussed. As I understand it, Anthem already has a product they can offer people potentially for coverage. So if a business wanted to cover this, they could do it, because there seemed to be some discussion that this was something that was wanted in New Hampshire to attract and keep young employees. So can't businesses already offer this coverage without us doing a mandate?
So speaking for Anthem, we do have some, but not all of our small group plans include infertility coverage today. And large group plans can include that benefit if they choose to do so.
Okay, thank you. Are you aware of any how many businesses in Maine might be offering the coverage right now?
Off the top of my head, no.
I didn't think so.
I can come back to you with that if that would be helpful.
Okay, thank you.
Okay. Representative Brooks, do you have a question for Ms. Awesomenfort? No. Okay, great. We're kind of in that section here. Is there anyone else with a question related to Anthem? Okay. All right. Thank you very much, Ms. Awesomenfort. Hopefully you're not in my Senate district experiencing such bad internet connectivity, because that would be quite embarrassing here in the great city of Portland. And we lost her entirely at that point. Okay. Or she just got moved back. Okay. Well, she won't comment on whether she's sitting in my neighborhood where she lives close nearby or not, but hopefully not. Maybe I'll just blame the windstorm we're having. I don't know if it's even windy today, but it was yesterday. Okay. A further discussion with regard to the motion that we have pending. Representative Brooks.
One point of discussion has to do with why it's possible that maybe with the state employee health plan, there could be a little bit skewed results for actuarial calculations. Is if we think of our state employee health plan pool, that group is pretty loyal. They've been around for a while. There aren't as many state employees, say, as there were 20 years ago, maybe, when the populations were higher, when people weren't leaving the state for other opportunities. With the infusion of funds into the state from different resources and investments, it's possible that the demographics and the shifts could happen with a recovery phase that we can't predict. That's just what I would have people ponder. So I wouldn't be quick to jump to conclusions during a pandemic, especially. We're in a period that we are in uncharted waters, and in that case, it may be well to kind of think about the possibilities as opposed to these rigid limits based on other circumstances.
Okay, thank you, Representative Brooks. Representative Brenner.
Thank you, Madam Chair. I was just thinking about this in sort of relationship with if we were to encourage businesses individually to decide whether or not to cover the service for their employees, and how awkward a situation that would be at a job interview for a man with a low sperm count to say to a potential employer, can you tell me whether or not your insurance policy covers infertility treatment for me and my partner? Like, that's, for me, just not a situation that I would like to set up for people. So that's why I feel like a mandate that pushes all of us to be able to have that coverage is the direction that I'm preferring to go in. Thank you.
Thank you, Senator Brenner. I am sad to confirm that even in Portland, we have all sorts of internet issues, as the Ms. Awesomenfort was in fact in my neighborhood. So it's not just a rural problem, lots of broadband problems across the state. I don't see any additional hands raised. Representative Arford, go ahead.
So before we actually vote on this, I just want to state that I will be voting in favor of this. However, when I started out, when we first started to hear testimony, I had not arrived at that conclusion. It was only after really doing my very best to listen to the testimony and the arguments that have been put forward, the data that we've been given, learning what other states are doing, that I have come to the conclusion that this is in fact the right thing to do. And I would like to see Maine, yes, follow the other states. I think there's 14, 15, that are offering some version of infertility coverage. I would like to also lead the way for those states who aren't yet offering it, and add our name to the states that are doing the right thing by the young men and women that are desperately, desperately, passionately desiring to start a family. And this coverage will make it possible for them.
Thanks, Representative Arford. Representative Morris, is that a new hand? Go ahead.
Yes, thank you, Madam Chair. I can appreciate again. I just think now is not the time to be adding a new mandate that is going to be costly to the employers. And I would, again, if the employment, the Chamber of Commerce testified against this bill because they know what it's going to cost their system. So I can appreciate that there may be businesses that would want to offer this to their employees, but they can already do so. And I don't think we need to be mandating that they have to have it. Again, it isn't that I'm without compassion in this situation. I certainly understand. I've had friends that have had these issues, but I've also had to buy on the individual market myself. And I know what rate increases do to people when they see it in their in when it's for a benefit that they themselves are not going to use. That is when you start to see people leave the marketplace and not buy coverage. And that is not a place we want to be either. And I just think that, again, right now, given the standpoint of trying to merge the two markets, where the press release went out the other day from the Bureau of Insurance, we're the first state to do it, to try and do that. I don't think it's a good time to be adding a mandate. And I think with everything the employers have had to deal with the last 2 years with this pandemic, I don't think it's a good time to be adding another mandate that's going to add costs into their system either. So for those reasons, I just cannot support this motion. I cannot support this mandate at this time.
Representative Tepler.
Thank you, Madam Chair. And well, I'm very respectful of Representative Morris's concerns about small businesses. I don't think that the majority of businesses that the statewide Chamber of Commerce represents are affected by a mandate to the insurance, to the fully insured market that we can affect. Most of the businesses that the statewide Chamber of Commerce represents are self-insured, and our mandates do not affect them. So that's not, the statewide Chamber of Commerce's opinion isn't necessarily relevant to the small business issues.
Okay, Representative Brooks.
We've processed a lot, and I heard the Honorable Senator Brenner speak of the awkwardness of having that as a question during a job interview, because it will come up. We know it will come up. So I don't know if people are interested in a corner caucus or just making a friendly amendment to amend the version to not have that as a question, or I don't know what the procedure is from here.
No, I think we're all set, Representative Brooks. I think I don't think it's I think the text of the bill takes care of that issue. Yeah. Okay. So I think with that, we have a motion on the table and a second. And unless there's any other member of the committee that hasn't spoken yet who wants to make a comment, all right, we'll have the clerk call the roll.
Thank you. Senator Sanborn,
Yes.
Senator Sanborn, yes. Senator Brenner,
Yes.
Senator Brenner, yes. Senator Stewart,
No.
Senator Stewart, no. Representative Tepler,
Yes.
Representative Tepler, yes. Representative Arford,
Yes.
Representative Arford, yes. Representative Blyer,
No.
Representative Blyer, no. Representative Brooks,
Yes.
Representative Brooks, yes. Representative Connor,
No.
Representative Connor, no. Representative Evans,
Yes.
Representative Evans, yes. Representative Matheson,
Yes.
Representative Matheson, yes. Representative Malorano,
No.
Representative Malorano, no. Representative Morris,
No.
Representative Morris, no. Representative Quinn,
No.
Representative Quinn, no. 7 members of the committee having voted in the affirmative, 6 in the negative.
Thank you. Is
I think
Colleen?
that was that right? I thought it was 8 to 5. Am I?
I think Representative Malorano voted against the motion.
Oh,
Yes.
Okay.
I just need to confirm, everybody voting against, are you all ought not to pass, or do you have a different version of an amendment?
We're for the 5 Republicans, at least, we're ought not to pass.
Thank you. Ought not to pass as well.
Okay, great, perfect. Thank you very much.
Okay, and my request, Colleen, would just be that I'd like to have some further discussion with regard to the fiscal note. So if you could convey some of the discussion that we had along to the analyst who's preparing the fiscal note, I think that would be very helpful, so that we're sure that things are buttoned up with regard to that.
Yes, they'll do a sort of an independent review of the estimates that Anthem may provide, that the state employee may provide, and
Yep.
sort of, look at the report itself and make a determination as to what their proposed estimate is as to cost to the general fund. And before anything gets reported out, it will come back to the committee. So once that is done, I'll make arrangements perhaps for them to come to our language review session. So you'll have an opportunity to ask them some questions about how they developed their fiscal note on it.
That's helpful. And I think it would be helpful to encourage them to look to other states' experiences as well, given how far out of line with those experiences the estimates from Anthem appear to me, to my untrained eye, to be. Great. Thank you.
And they'll have all the information that, I had shared with you about other state cost analyses and all that sort of stuff. So I'll follow up with them and they'll be able to listen to your conversation as well and work on pulling that fiscal information together for you.
Thank you. Okay, so with that, we have concluded our work sessions for the day, and we have a number of language reviews available for us. So Colleen, I'm going to have you walk us through those quickly.
Great. I have a few for bills that the committee had previously voted. I was able to share these earlier this morning, so maybe folks have had a chance to review. But the first one, we're still waiting on the fiscal information, but I wanted to bring the language back to you first so you could take a look at it. So you'll see this again, but the first one is LD 1003, which is an act to improve outcomes for persons with limb loss. This was a bill that was voted unanimous, ought to pass as amended. The amendment would make a change to our existing mandated benefit with regard to coverage of prosthetic devices to require for enrollees who are under the age of 18, in addition to the coverage that's required for a prosthetic device that meets the enrollee's medical needs. For those children under 18, coverage would be mandated for an additional prosthetic device determined to be the most appropriate model that adequately meets the recreational needs of the enrollee, to maximize the enrollee's desire to ambulate, run, bike, and swim, and to maximize upper limb function if they're affected in that way. And then it makes a technical clarifying change to recognize that there is a current prohibition in the law that prosthetic devices are not required to be covered for exclusively for athletic purposes, but it recognizes that with regard to recreational needs for those children that qualify, they would be able to have the benefit of the coverage required. You had not added specifically an application date to this bill when you talked about it, so it's not in there currently. So that is one question that I wanted to follow up with you again to see if you thought that that was necessary. It is an expansion of coverage. And then the other thing I wanted to talk to you about is whether or not you wanted to add that language you talked about earlier for this bill that you talked about with LD 665 and LD 1357 related to the extent that there might be any additional costs that would be, the state would be required to defray under the Affordable Care Act, that you viewed this as an expansion. You believe that this was medically necessary and, you know, related to that language. So that was those were two additional questions I wanted to just ask you to clarify for me with regard to LD 1003.
Pauline?
Yes.
Maybe this is picking nits. Madam Chair, is it okay if I go ahead?
Yeah.
Take away.
But to me, I think the section that says on athletic purposes, that's somewhat in conflict with paragraph B. And I guess what I would like to see it say is for a prosthetic device that is designed exclusively for an athletic purpose. So thinking like it's for a particular sport. I think that's what we were getting at, as opposed to all athletic purposes, because certainly ambulating, running, biking, and swimming are athletic purposes. They're just not for a particular sport, competitive sport particularly. So I think I would like to see that language be a little bit more specific. Does that make sense?
Mm-hmm. Yep, I can do that. Thank you.
Mm-hmm.
I'll stop sharing, but on the question of application date, I'm looking for my notes.
Yeah, I had thought we talked about application date. We must have missed it. But that should be in there. And then I thought we had also talked about a mandate statement.
I think you did. I think you didn't go back to it when we made the motion. So it wasn't all included in my notes when you made the motion. So I just wanted to double check with you that you intended it to include both of those things in this bill as well. I just wanted to make sure I had that clear. I think that was probably my fault.
I thought so.
Okay, good.
That was my recollection, was that we had added that statement to each of the bills, but we may have thought of it after we took the vote and kind of retroactively said, go back.
Right, right.
So that may be the issue. Is this a unanimous?
It is. Yes.
Okay. And so do we need a motion to reconsider? Can I just get consent of everybody here that that's what we meant?
I think that's right. I don't think you need to reconsider. I thought that you wanted it included, but I wasn't absolutely sure. And I think it was my notes weren't entirely clear to myself. So I think you definitely talked about it. I just couldn't remember if it was specific to this bill, and I didn't include it in my notes about your specific motion. So I just wanted to clarify it.
Okay, thanks.
Thanks. That's the first one and
Okay.
probably the most, the one that'll take the longest. The next one is LD 1798. And this you had reviewed previously, the language of this amendment. This is the bill that relates to adding a requirement that insurance companies offer coverage for a dependent child who has a disability regardless of their age. But you hadn't yet had the fiscal information. So I just wanted to share with you that that has been received and no fiscal impact. So I wanted to make sure you saw that, and that should be on the calendar on next Wednesday.
Great.
So that's LD 1798. And then going in order, this next one is LD 1815. You had also looked at this previously, the language of the amendment. This is the Bureau of Insurance's bill, making some changes to conform with the model laws from the NAIC. So the language of the amendment you previously looked at and approved, hadn't yet had the fiscal information, which I don't think I attached to this version, I'm sorry to say, but that came back minor costs that can be absorbed by the Bureau of Insurance. But I did want to share with you this draft memo. This will have to go to the Judiciary Committee for a further review because the original bill contains a public records exception. It designates certain information shared with the Bureau as confidential related to liquidity stress tests and group certain ratios, group capital calculation ratios. And so this is a draft of a memo to the Judiciary Committee. It follows along the form that we have used in previous sessions to provide to the Judiciary Committee. So I just wanted to share that with you, going through the criteria and really just recognizing that for proprietary reasons, I think is really the primary reason for supporting a public records exception here, and that it's necessary to meet the sort of accreditation standards of the NAIC pursuant to their model law. The Judiciary Committee, as I understand it, will be reviewing this bill and the next bill we're going to talk about next. They've scheduled the time next Friday morning on the 25th at 9 a.m. So I wanted to pass that along, and I assume or hope that Senator Sanborn will be available that day.
I will be, and I will put it on my calendar right now.
Yes. Great, thank you. And then the next one is also subject to review, but this was a bill that was voted ought to pass unanimously by the committee. This is the bill that establishes a Securities Restitution Assistance Fund. But I did want to bring back for you that it will require a fiscal note amendment, although it the fiscal note describes impact only for other special revenue. So if it moves forward, it won't be a bill that would be required to sit on the special appropriations table before its final enactment, but it does need to be amended to include this fiscal note. So your original vote technically was ought to pass. It will need to be reported out ought to pass as amended. I'll leave that to you, I think, as to whether or not you think you need to take a formal sort of reconsideration of the vote. I know sometimes in the past committees have done that. Other times they've sort of just understood that if it needs a fiscal note amendment, you just sort of change it as necessary. But it will be reported out ought to pass as amended to incorporate this fiscal note. And then similarly, I've drafted an amendment asking the Judiciary Committee to look at the provision in this bill that is a public records exception. And with regard to LD 1887, it designates as confidential personal information that someone who's applying for restitution assistance from the Office of Securities would be including in their application. And it would protect from public disclosure their social security number, their address, and their telephone number, which I think is consistent with existing statutory protections for personal information. So that's what the language, sort of the memo lays out, that why that is necessary, because it's personal information that should not be disclosed to the public. So that's LD 1887.
Colleen, can you remind me, I think LD 1887 actually had allocations in it. It just didn't have the fiscal note on it. Is that right?
That's correct. Yes.
Okay.
Yes.
So, so it's
it-
not a surprise fiscal note in any way, shape, or form.
No, it's not.
Okay, I know that in the, oh, Representative Tepler, go ahead, you have your hand up.
Yeah, I wanted to ask if Colleen could review the procedure for a bill that has a fiscal note with OSR funds on it. Does it go through to the table and then it has to be exempted from the table? Does it not go to the table? I need a reminder of how that works.
Typically, those bills do not go to the table. They can be enacted without reference to the special appropriations table before final enactment. So my understanding is that this bill would not have to go to the table prior to its enactment. As Senator Sanborn mentioned, there is a provision included in the bill to transfer other special revenue funds of $350,000 as a one-time transfer to sort of provide the initial funding. And then this fiscal note sort of expands on the additional funds that would be received from a portion of licensing fees. And
Yes,
so
it
that's what you see
allocates
reflected
those
here.
funds.
It's allocation, exactly. None of it
Yes.
would be general fund. So
Yes.
I don't think it would have to go to the table.
I just wasn't sure. Sometimes I know bills go to the table and need to be exempted from the table, but it's good to know this one can just pass through the process.
I believe that's the case. I will confirm, and if it is or becomes an issue, I'll let both of you know, but we've never had that situation in the past.
Okay, good to know. Thank you.
Is there anyone on the committee who objects to us just deeming our ought to pass motion and ought to pass as amended motion? If you could raise your hand, I know in other committees they would do a whole reconsideration rigmarole, but I suspect it's not necessary, but I won't do it unless there's unanimous consent. Okay, I see no objection. So we'll just deem that to be good to go. Thank you for stopping sharing. I think we have one more bill to go over.
We do, yeah, one more, but I just want to make sure you could see people's faces. And then the last one is similarly, this was LD 1920. This bill also will require a fiscal note. The original vote of the committee was ought to pass. This is the bill that would enact the Interstate Counseling Compact for Maine, and it incorporates a fiscal note. And as we discussed with LD 1887, the fiscal note speaks to potential cost increases and revenue increases of other special revenue funds to the Board of Counseling Professionals licensure. So it lays out the impact. Of course, you'll recall from our discussion of the bill, the sort of effectiveness and the implementation of the compact depends on or is contingent on 10 states enacting it into law. That has not yet happened. So it's sort of the fiscal note describes a contingent sort of future potential increases in impact on other special revenue funds, but it does add a fiscal note to the bill. Because it does focus specifically on OSR funds and not the general fund. My expectation is that if this bill moves forward, it would not have to go to the special appropriations table either. But it is a situation where it will have to, the vote will have to be changed to OTPAA.
Okay. So I'll do again, just raise your electronic hand if you object to us deeming our vote OTPA. I don't see any objections. So I think we're all set with that, and great unanimous work in our committee for the most part. So thanks everybody. I think that's the end of our work for today. It's certainly the end of my dog's tolerance with Zoom for the day. Although I suspect Colleen and Denise, we need to have a brief scheduling conversation. She's going to make sure we keep it very brief. So thank you, everyone. Have a wonderful afternoon, and
see you next week.
We'll see you next week. Bye.
Thank you.
Bye. Thank you.